Don't overlook these 10 early indicators of diabetes. You could be saved by it. Did you know that millions of individuals are unaware that they have diabetes? Early detection might make all the difference, but the symptoms can be subtle, cunning, and easy to ignore. This video explains the 10 early indicators of diabetes that you should be aware of, ranging from odd skin changes to nerve damage that may affect your feet. You might be surprised by some of these symptoms. However, by identifying them early on, you may take charge of your health before it's too late. Stay with us through to the finish because you could save your life if you recognize these warning signals. Number 1. Frequent urination and thirst. Everyone has woken up in the middle of the night to go to the toilet or get a drink of water. But if this occurs often, it may be a mild indication that something is wrong with your blood sugar. The kidneys must work harder to filter more glucose when blood sugar levels are high, which causes polyuria or frequent urine. The body expels a lot of water along with the excess sugar, leaving you feeling thirsty and dehydrated. This never-ending cycle of drinking and using the restroom might disrupt your sleep and cause you to feel exhausted during the day. If you experience excessive thirst or more frequent urination than normal, consider these symptoms to be warning signs from your body. Begin by routinely checking your blood sugar, particularly before bed, and discussing any concerns with your healthcare physician. To assist your body work properly, it's also a good idea to drink plenty of water during the day. However, you should cut back on your water consumption just before bed. Blood sugar may be stabilized with simple adjustments like cutting less on sugary drinks and eating meals that are balanced and high in fiber. Monitoring thirst and bowel habits is essential for older persons with diabetes. If ignored, these symptoms may result in exhaustion or even renal stress. The good news is that you regain control when you are conscious of these minor adjustments. You may enhance your sleep and prevent diabetes-related complications by taking action, whether it be through nutrition, lifestyle, or monitoring changes. Number 2. Skin signs. Have you ever had black, velvety skin patches appear around your groin, armpits, or neck? Acanthosis nigricans is a skin alteration that may appear innocuous, but it may be a sign of insulin resistance. Insulin levels rise as your body begins to fight its natural ability to transfer sugar from your blood into your cells. Then, high insulin causes skin cells to proliferate more quickly, especially in places like the neck and underarms where skin rubs against one another. The outcome? In reality, those areas that may appear to be pigmentation or dirt are early indicators that your body isn't correctly absorbing sugar. Don't ignore this if you see it. Rather, see it as a chance to take control of your health. In addition to preventing these patches from worsening, managing insulin resistance with diet, exercise, and routine blood sugar checks can also halt type 2 diabetes or prediabetes from advancing. Replace sugary snacks with nutritious foods such as lean meats, leafy greens, and healthy fats. Your body's sensitivity to insulin can also be improved by doing easy workouts like mild weight training or brisk walking. Looking better isn't the only reason for these lifestyle adjustments. One step at a time, they aim to help you feel better and regain control over your diabetes. Number 3. Skin tags. Although skin tags may appear to be innocuous growths, they can also be a covert indicator of insulin resistance. These tender, flesh-colored flaps frequently appear in the neck, armpits, or groin, which are places where skin folds together. It's time to take attention if you've seen many skin tags that seem to have appeared out of nowhere. These tags may occur as a result of the skin growing more quickly due to high insulin levels. It's your body's subliminal message that something is amiss. What are you able to accomplish then? Don't panic first. The actual skin tags are widespread and innocuous, especially as we age. Their existence, nevertheless, may indicate that your blood sugar is out of control. Speaking with your doctor about getting tested for insulin resistance or prediabetes is a smart decision. You have the opportunity to prevent type 2 diabetes and its consequences by making adjustments when you catch it early. The good news is that blood sugar control doesn't have to be difficult. Make an effort to eat well-balanced meals that include lean proteins, healthy fats, and veggies high in fiber. Reducing the consumption of processed meals and sugar-filled beverages can also have a significant impact. You'll be on your road to improved health if you combine it with a little daily exercise, such as a quick stroll after supper. Little things count, and something as basic as skin tags could be the reminder your body needs. Number 4, recurring infections. Have you ever had the feeling that you are battling one infection after another? Whether it's a persistent yeast infection, UTI, persistent urinary tract infection, or persistent skin problems, there may be more to this than bad luck. Diabetes creates the ideal environment for bacteria and fungus to grow, especially when blood sugar levels are elevated. These organisms may grow and proliferate because of the fuel provided by high blood sugar and even urine sugar. Your body finds it difficult to successfully fight off infections when you combine it with a compromised immune system brought on by diabetes. It's critical to make the connection if you've observed recurrent illnesses. Your blood sugar may be out of balance if you have recurring UTIs, yeast infections, or skin abscesses. Ignoring these illnesses is not only irritating. If treatment is not received, it may result in more severe problems. Speak with your doctor about your symptoms and have an insulin resistance or diabetes test performed. It's a preventative measure that can safeguard your general health and help you halt illnesses in their tracks. The most effective defense? Bringing your blood sugar under control with easy lifestyle adjustments. Increase your intake of complete, nutrient-dense foods like veggies, lean meats, and healthy fats while decreasing your intake of processed foods and refined sugars. Hydration is also essential. Your body normally eliminates extra glucose with the aid of water. Little routines, such as taking a 20-minute walk every day or routinely monitoring your blood sugar, may boost your immunity and make you feel your best. Your body's ability to heal itself is amazing. Give it the resources it requires. Number 5, diabetic stiff hand syndrome. Have you ever attempted to close your hands in prayer, only to find that your palms cannot contact or your fingers will not straighten completely? This is more than simply stiffness. It may indicate diabetes chiroarthropathy, another name for diabetic stiff hand syndrome. It occurs when carbohydrates bond to proteins in your skin and tendons through a process known as glycosylation brought on by persistently elevated blood sugar. Your hand's range of motion is eventually restricted as a result of the soft tissues becoming thicker and less pliable. Although initially painless, this ailment can grow increasingly restricted if untreated, affecting your ability to type, hold things, and carry out everyday duties. This stiffness isn't brought on by joint injury, which is why many people confuse it for arthritis. It's wise to have your blood sugar levels checked if you're exhibiting signs such as a positive prayer sign, in which your hands refuse to straighten or shut completely. Early detection is essential to prevent more issues. How should diabetic stiff hand syndrome be treated? Make an effort to maintain a healthy blood sugar range by combining regular exercise, a balanced diet, and regular monitoring. Maintaining flexibility can be aided by basic hand stretches and exercises, such as pushing your fingers against a flat surface or opening and shutting them. Recall that controlling your blood sugar promotes optimal bodily function and protects more than just your hands. A stronger, more competent tomorrow can result from little, thoughtful efforts taken today. Number 6. Trigger finger and frozen shoulder. Your body may occasionally give you tiny cues that something isn't quite right, such as when your shoulder becomes painful or a finger seems stuck in place. Trigger fingers and frozen shoulders are conditions that can cause more than simply sporadic discomfort. Movement becomes challenging for diabetics due to inflammation and thickness of the tendons and surrounding tissues brought on by high blood sugar. Your joints may eventually feel as though they are locked up, which can be uncomfortable and make it harder to complete basic activities. As you attempt to straighten your fingers, you could discover that one or more of them are snapping or catching if you have a trigger finger. A little sensitive bump may even be felt at the base of the afflicted finger. However, a frozen shoulder can make it difficult to reach behind you, raise, or spin, which can have a big impact on your day-to-day activities. Although these disorders are surprisingly prevalent among diabetics, they are frequently disregarded until their symptoms get worse. The good news? Early intervention has a significant impact. To preserve mobility, begin with mild stretching exercises. Then, concentrate on controlling your blood sugar levels to lessen inflammation. Discuss treatment alternatives with your doctor, such as physical therapy or anti-inflammatory medications, if the stiffness continues. You may restore flexibility, lessen pain, and continue moving with confidence if you take care of these symptoms as soon as possible. Number 7. Neuropathy and foot damage. This is frequently the initial sign of neuropathy or damage to the nerves brought on by elevated blood sugar. You may eventually lose the capacity to feel pain, heat, or even injury due to nerve loss, particularly in your hands and feet. Although it may first appear innocuous, this loss of feeling can cause cuts, blisters, or minor wounds to go undetected, which can result in dangerous side effects including infections and ulcers. Damage to diabetic feet doesn't end there. Diabetes impairs circulation, which hinders the healing of wounds. If treatment is not received, these wounds may worsen and develop into serious infections, which may eventually result in amputations or Charcot foot. It's a frightening fact, but if you continue to take proactive measures to control your blood sugar and foot care, you can avoid it. Simple everyday routines are the first step in protecting your feet. Wear injury-preventing shoes that fit comfortably and check them daily for cuts, swelling, or color changes. Control your blood sugar levels to enhance circulation and safeguard your nerves. See your doctor right away if you experience any problems, such as chronic numbness, non-healing sores, or changes in the form of your foot. Maintaining your feet is important for more reasons than just comfort. It also protects your general health and freedom. Number 8. Severe infections and amputations. Even a little cut or blister can develop into a dangerous condition when diabetes is present. Your immune system is weakened and blood flow is decreased by high blood sugar, which makes it more difficult for your body to heal wounds, particularly those sustained on your foot. Wounds that are left untreated may eventually turn into serious infections that spread to the surrounding tissues and bone. At this point, things get risky since infections that don't go away might result in amputation. A final measure to prevent the illness from getting worse. Although it's a terrifying result, it takes time. Redness, swelling, or a wound that doesn't go better over time are common early symptoms. Because neuropathy or damage to the nerves can make it difficult to feel these injuries, the infection may have progressed by the time they are discovered. For this reason, regular blood sugar control and frequent foot exams are crucial for anybody with diabetes. Early detection of minor problems can save them from developing into serious problems that could change your life. Here's how to maintain your lead. Develop the daily practice of checking your feet. Keep an eye out for any wounds, bruises, or changes in skin tone. Don't disregard anything out of the ordinary. Maintain a healthy blood sugar range to enhance circulation and support your immune system's defense against infections. See your doctor immediately if you see a problem. Even a little infection has to be treated right away. You can remain active, healthy, and in charge of your future if you take care of your feet now. Number 9, gastroparesis. Have you ever experienced chronic bloating, nausea, or vomiting, or felt full for hours after a modest meal? The stomach takes far too slowly to evacuate its contents, a disease known as gastroparesis, which might be the cause of this. The vagus nerve, which regulates the muscles in the stomach, can be harmed by high blood sugar in diabetics. Digestion slows down when this nerve malfunctions, resulting in erratic and painful sensations. That's not the end of the issue. Because your body absorbs carbs differently when you have gastroparesis, your blood sugar levels may fluctuate. At times, digestion may occur suddenly, and at other times, a single meal may remain in your stomach for hours, resulting in a prolonged rise in blood sugar. Diabetes management is made more difficult by this roller coaster impact, which may also make you feel ill and irritated. Small, easy adjustments are the first step in managing gastroparesis. Instead of 3 large meals, try eating smaller, more frequent ones, and concentrate on foods that are soft and easy to digest. To assist your stomach emptying more efficiently, chew your food well, and think about sitting up straight after meals. Above all, collaborate with your physician to improve your blood sugar control. Even though gastroparesis might be difficult, being aware of it and taking little actions can greatly improve your comfort and control. Number 10, hemoglobin A1C. What should you do now that you are aware of the early indicators of diabetes? It's easy yet very important. Get examined. The gold standard for determining your typical blood sugar levels over the previous 2 to 3 months is the hemoglobin A1C test. It's a trustworthy method of determining if you have diabetes or prediabetes, and it frequently serves as the catalyst for many people to take action. It's time to discuss getting this test done with your doctor if you've seen any of the symptoms we discussed, such as changes in your skin, nerve problems, or frequent thirst. Although an A1C of 6.5% or over indicates diabetes, even slightly higher readings may indicate prediabetes, which may allow you to reverse the condition. If you catch it early, you may safeguard your health for years to come by making small lifestyle, food, and activity modifications. Keep in mind that knowledge is half the fight. Take control of your health, set up the test right away, and give yourself the best chance of avoiding diabetes. The first step is to recognize the indicators. What really makes a difference is action. Make sure it's right for you by speaking with your healthcare professional before making any changes to your diet, exercise regimen, or way of life. Your safety and well-being come first. Keep in mind that you have the ability to take charge of your life and safeguard your future by identifying these early indicators of diabetes. Simple actions like as maintaining an active lifestyle and eating better can have a significant impact. To ensure you don't miss any more health advice, please press the bell button, subscribe to our channel, and give this video a thumbs up if you found it useful. Leave a remark below with your ideas or queries. See you in the next video.